Hi everybody, my name is Nigel Cooper and I work for Asthma Australia, and thank you for joining us on World Asthma Day. Today we're going to talk about the great Aussie asthma myths, and we're going to bust some of those myths. And our guest speaker today is Dr. Tim Senior. Welcome, Tim.
Thank you very much. It's a pleasure to be here. Hello to everyone.
Tim is as a GP at the Aboriginal Community Controlled Health Service in Western Sydney, and he also forms part of our professional advisory council here at Asthma Australia. And I'm the senior manager programs for Asthma Australia, and also a registered nurse. So before we get started with our webinar tonight, I would just like to recognise the land that we are meeting on today, and recognise the traditional owners of this land, and pay our respect to elders both past, present and emerging. And today I'm actually meeting on Kaurna land. So again, I recognise the traditional owners of this land. So Tim, today for World Asthma Day, we're really going to talk about busting some asthma misconceptions or myths.
So, do you need to have a wheeze for it to be asthma?
Yes.
Yeah.
Do you need to have? Yes, correct.
So it's a really interesting question, this, because wheeze is one of the main symptoms of asthma, but it is just one of the symptoms of asthma. And it's a common one, but it's not present in everyone, and it may be less common than some people think. And so people may wheeze, but people need to look out for the sudden absence of wheezing. If that's their normal, that can actually be a danger sign and needs checking out. And some people have symptoms of asthma but don't get wheeze as their main symptom. They have other symptoms. And so it's great to have an opportunity to talk about those things this World Asthma Day.
So before perhaps we get into the asthma, does it have to have a wheeze or not have to have a wheeze? So why don't we talk a little bit about what asthma is? So could you take us through, Tim, what actually is asthma?
Yeah, so asthma is it's a common long-term health condition, so it often lasts a long time through people's lives, and it's mainly inflammation in the airways and the tubes going down to the lungs. And what that does is it makes the airways narrower, so that the muscles go narrower and make the tubes small. There's inflammation, which means swelling, and often that produces mucus as well. And all of those narrow the tubes so that the passage of air going up and down the tubes, the flow of air down to the lungs, is reduced and more difficult. And that fact in the tubes of going down to your lungs produces the symptoms that people will recognize as their common asthma symptoms. And wheeze may be one of those, but it's not the only one.
So going back to your point then, if you can get asthma without getting wheezy or having a wheeze, why do you think this wheeze and asthma misconception exists?
I think it's because it is one of the common symptoms. It's what people are asked about when they see a doctor. It's often what they experience as asthma. It's often what family members will talk about when they have asthma. It's often what school teachers will ask about when children have asthma. And it's one of the common symptoms that often isn't, in many people, isn't associated with any other conditions. And so I think it's easy to focus on that single symptom of wheeze that's always associated with asthma. And one of the things that's important for us as doctors is that it's unusual that there's just a single feature of an illness, and so the pattern of time and the other symptoms associated with it are often what is really important to tell in order to tell what's happening for someone.
So when you do wheeze, what does this mean in terms of your asthma getting worse?
Yeah, so the wheeze is a symptom of those narrowed airways. So it's a bit like having your airways when they're narrow and the air's trying to go in and out of those. Each little airway whistles a little bit, a bit like a flute or a tin whistle, and you can hear all of that whistling at once. Sometimes you can hear that just talking to someone or someone breathing. Sometimes you can't hear it unless you put a stethoscope on someone's chest, but that's what's happening with wheeze. That's why it's often associated with people's asthma. And the important thing is, if people with asthma, asthma is a long-term condition, but it can be well controlled with the right treatment. So if people are getting wheeze regularly, that's always worth a checkup to see whether their asthma could actually get under better control so people don't wheeze.
Mm. So can you hear an asthma wheeze, Tim, when you breathe in or when you breathe out?
Yeah, that's a good question. And usually it's on breathing out. So
Mm,
the air gets trapped in the lungs, and people often have to work quite hard to get the air out of the lungs through these narrowed
mm,
tubes. And
mm,
that's often what makes people cough as well, to
mm,
sort of push
mm,
the air out. Wheeze can happen when breathing in, but sometimes that can be a sign of other things. So again,
mm,
if that's a predominant feature, I think people should be getting that checked out with their GP and saying to them, this is an unusual symptom for me. I've actually got wheeze when I
mm,
breathe in, not when I breathe out.
mm. So some people have chatted to us and said to us they don't always get their wheeze with their asthma, and then sometimes they do get a wheeze with their asthma. Can this symptom change depending on the triggers that people are exposed to?
Yeah, it can. And I think one of the things that I've learned talking to many different people with asthma um, is that they get a pattern of symptoms that they will recognize,
Mm,
and they'll recognize the sorts of things that trigger their symptoms. And so I think some people will find um, as they grow, their airways grow. When they move from being children to teenagers to adult, and sometimes as they get older, the state of their lungs changes a little bit too. So people's symptoms can certainly change. People's triggers can change, and so people's symptoms can be different with different triggers depending on
mm,
whether it's more an inflammatory process or more an allergic process. Um, People often become very familiar with their own
mm,
asthma symptoms. So whether
mm,
they provoke difficult breathing or a
mm,
cough or wheeze as their main
mm,
symptom, and they get to recognize their triggers.
mm,
So knowing your own asthma
mm.
can be quite important.
That's a really good point in the sense of understanding what my asthma means to me and then the symptoms that I actually portray when I have my asthma, as opposed to comparing it perhaps to other people and what they look or sound like or how they react. I know just recently I was chatting with someone and they were wheezing as they were talking to me.
Mm.
And I said to them, "Oh, you're wheezing." And their response was, "Well, yeah, I have asthma." So they'd kind of just thought that asthma and wheezing was just a normal part of life. So if you have asthma, is it normal for you to wheeze all the time?
It's such a good question. And my sense as a GP is that asthma treatment is so much better than it used to be now, that our aim is to stop people being short of breath, stop people wheezing, and most importantly, people should be able to
Mm,
live their normal life that they want to live
mm,
without being limited by their wheeze or without being
mm,
limited by their shortness of breath. And that would
mm,
include sleeping through the night as well. Often
mm,
people get have symptoms during the night or in the early hours of the morning.
mm,
And so I think if wheeze is or other respiratory symptoms are a common symptom
mm,
through the day or through the night with people's life, that's definitely worth checking
mm,
out,
mm,
because many of the treatments mean that that can be avoided and people can live a
mm,
much more comfortable life
mm.
to get on with the things they want to do.
So that's a really good summary then of people who wheeze with asthma, but we also have that group or cohort of people who actually don't wheeze. And we've heard from quite a few people who just say, well, I never wheeze with asthma. I might have other symptoms. And there's a phrase that's been coined that's called silent asthma. Is this correct?
It's a really interesting. I'm fascinated to see all the people who've talked about their non-wheezing asthma,
Mm,
because as we mentioned, wheeze is one of the symptoms, but it's not the only symptom and not the
mm,
exclusive symptom. So there are a group of people out there whose signs of asthma won't be wheezing, but will be coughing, will be feeling short of breath, and so that may be called silent asthma. There's
mm,
almost two versions of silent asthma. One is those
mm,
symptoms of asthma that aren't wheezing, and
mm,
then one that worries me very much as a doctor is where the when we listen to the lungs, and actually they're um, they're struggling so much to get air in and out of the lungs.
mm,
You can't hear wheeze and you can't hear the air
mm,
moving. And so we do often call that silent asthma or silent
mm,
chest, which is it's a sign of someone being very unwell from their asthma
mm,
and
mm,
needing quite urgent treatment for it. So so the lack of asthma, particularly in the lack of wheeze rather, particularly in people where they might normally have had wheeze, that may be a sign of actually of worsening asthma because they're not moving as much air. But then there's another group of symptoms where their normal symptoms aren't to wheeze. They're more cough, more feeling short of breath, and sometimes some other more unusual symptoms.
So I guess the key message for us is that you don't have to wheeze to have asthma, and perhaps the term silent asthma is probably not correct because you either have asthma or you don't. But what you're saying then is that your symptoms could vary, so you could end up, like you said, with a cough or shortness of breath and not wheeze, but it is still asthma.
Yes, that's right.
For people that don't wheeze, is cough the most common symptom?
That would be one of the most common symptoms, I think. I think feeling short of breath as well. So that sense of not being able to get enough air into them. Some people feel tight across the chest and feel their chest being tight.
Yep.
And that's because the tubes are tight. They're literally actually tight. Some people, a sign we look for if people are talking to us about asthma is the ability to speak full sentences and the ability to do the activities that they would normally do without getting short of breath. So any of those would be symptoms that would be looking out for in someone with asthma who didn't have wheeze. And then the timing of those symptoms as well. So any asthma symptoms often have triggers associated with them, and those people often get to know their triggers quite well. They're often associated with picking up a viral illness like cold or flu. They're often associated with nighttime because everyone's airways are narrower at night. And they're often associated with cold temperature. So they can be worse this time of year. They can be worse early hours of the morning. That's sort of particularly cold down in the southeast states of Australia. So people may notice, and often worse with physical activity, exercise. So playing sport, running for a bus. And so that pattern of symptoms can be a really important pointer to asthma as well.
So thinking then about parents, so if for parents of children then, if we're recognising that not everybody wheezes with their asthma, as a parent of a child, what kind of symptoms or signs should a parent look out for that their child might have asthma, number one, or secondly, that they're having a bit of an asthma flare-up or an asthma attack?
Yeah, that's a really good question. So some children might wheeze, others it'll be a cough, and particularly with those patterns we're describing earlier, because coughing is common in children because they're very fond of passing around their illnesses between each other. But that pattern of cough, overnight, cold weather, particular triggers, exercise, can be and viral illness can be a pointer to a child having asthma. And ultimately for older children greater than older than 6 or 7, adolescents, adults, spirometry is actually the best way of being able to get an asthma diagnosis, because that's a demonstration of the narrowing of the airways to the lungs. That is reversed by salbutamol, the reliever puffer.
So I guess the key thing for parents is to actually look, like you said, gauge a pattern for their children and look at when they might cough or experience some kind of symptoms. What about in really young children? So like if you had a 3-year-old, would there be anything physical if they were sleeping or lying down? Was there anything physical that you might see?
Yeah, so for really young children, the symptoms and signs can be quite subtle. And I think in general, if you're worried, that's always worth getting your child checked out. And there can be a range of symptoms a range of conditions that trigger similar symptoms. So I'd be looking for particularly any child that's struggling to breathe and looks like they're working hard to breathe. That could well be asthma. Obviously, hearing a wheeze, that pattern of cough we were talking about. But sometimes it shows itself in times like times of feeding or times of physical activity. If they're struggling more to do that, or if they're more tired than you'd expect, or they're waking up in the night, those could all be signs of asthma. And I think if there's something that's unusual for your child and you don't think it's quite right, that's definitely worth getting checked out.
Good point. I was speaking to a parent the other day, and they commented that with their young child, they look at their tummy. So they lift their
Yes.
shirt up and they gauge their tummy, and if they especially in winter when they've got jumpers and jackets on, but if they look and see their tummy moving what they consider to be a bit excessively, then that's a good indicator for them that their child might be having a bit of difficulty breathing, and then they give them their asthma medications.
Mm.
You talked a little bit about diagnosing asthma. You talked a bit about that we can do spirometry, and we might talk about spirometry in a little while. From a diagnostic point of view, is it more difficult to diagnose people with asthma who don't have a wheeze?
Um, it probably is, because wheeze is sort of considered to be the classic asthma symptom, and without that, there may be other causes of the symptoms that they have, and spirometry is really useful at
Mm,
working out those different possibilities.
mm,
And again, we tend to collate all that information together to
mm,
make a decision with the patient. So the story and the feelings that the person has and the pattern
mm,
that they have, that their
mm,
symptoms come on, the examination of listening to the lungs and seeing what their oxygen levels in their blood are, and seeing how they're struggling, how much they're struggling to breathe, and then spirometry on top of that, and also sometimes looking for other causes that might be
mm.
responsible for those similar symptoms.
Mm. So when a parent or somebody goes to see their doctor, and they're querying it should be asthma, the asthma diagnosis then is made up of all of those things, like you said, their history, their patterns of breathing, the physical examination where we might listen to the chest, look at the way they're breathing, and then spirometry you touched on. So spirometry is where you blow into a machine, isn't it? And it gauges you how quickly and easily you can push your breath out. Does every GP do spirometry, Tim? And if they can do spirometry, are there any age limits that you can or can't do spirometry on?
Yeah, so it's worth checking with your GP whether they do spirometry. Increasing numbers of GPs are doing spirometry, and often practice nurses will be trained to do that.
Mm,
And certainly we're encouraging easy access to
mm,
spirometry, because it's the best test we have.
mm,
The Younger children will struggle to do the breathing test and breathe quickly through the tube. So it's often children older than 6 or 7 who are able to do that. It can be hard to do when you're having an asthma attack itself.
mm,
So often we do it when people are well again,
mm,
to confirm the diagnosis that we suspected, because it can be it's really difficult for someone who's struggling to breathe to say, now breathe
mm,
into this tube really quickly for me. Um,
mm,
and then some people who might be older sometimes struggle to get the volume of air through the machine. And again, sometimes there can be a mixed pattern with other conditions such as
mm,
chronic obstructive pulmonary disease.
mm,
And again, but the only age limit is children who sometimes struggle to actually
mm,
just do the test.
mm,
It's a useful test if people are able to do it.
mm. Do you ever find, or do patients sometimes come to you with symptom diaries, Tim? Like, is that useful if somebody keeps a symptom diary and says, this is when I feel short of breath, or I cough, or I wheeze, or with my child, I notice they cough and wheeze when they're patting the cat or they're playing sport. Are symptom diaries useful?
They're really useful, because
Mm,
it's like a um, a live. It's better than memory. You
mm,
actually can spot the patterns, and often um, people will often keep a symptom diary, and the patterns become obvious before seeing the
mm,
GP. Um, and it can be really helpful at just spotting those patterns
mm,
coming out, either
mm,
particular times of day, particular
mm,
activities, particular triggers.
mm.
So those are really helpful in making a diagnosis and those sorts of patterns we were talking about earlier.
Mm. Awesome. So I'm getting the idea here that a really good tip for parents or for people who think they may have asthma or their asthma symptoms are worsening is to have as much information as they possibly can when they see their GP. So have a symptom diary, talk about the symptoms that they're seeing, observe their children and take in some of that. So when they go and see their GP, they're providing a really nice clinical picture of asthma or asthma symptoms in a home environment, which I guess the GP can then cross-reference with their medications and their asthma action plan.
That's exactly right, and that is really
Mm,
helpful. And I think the other thing that's helpful is if you're worried about something particular, or you
mm,
have people having their thoughts about what's happening, about
mm,
it being asthma worsening, or could it be something else, um, you share that with the GP as well,
mm,
because
mm,
then very often they're right, but we can always have a discussion
mm,
about those, and it's really helpful to know what the
mm.
patterns are and what you're thinking about it.
Awesome. We did a bit of a poll before and we asked people to write in some questions. And I've just got a question here, if I could just read this out to you from somebody on our Facebook. And their question is, and I'll read it out word for word, my son only wheezes at night. So when I take him to the doctor during the day, they often say, no, he's not having an asthma flare up. He sounds okay. They don't give me any further medications and they send us away to monitor it in case it gets worse. The question is that this can sometimes be a bit of a pattern for parents in the sense that the children might only experience symptoms overnight, and then when they take them to the GP, they're fine and they're okay, and they don't seem to be posing any asthma symptoms or questions. Um, is there any tips that you can give to parents to maybe get their message across more clearly, or be more persistent if they have concerns?
Yeah, it's a common problem. Certainly, I know when I'm listening to the lungs of someone with asthma and they've been
Mm,
awake through the night, normally they get in to see me in the afternoon and it's the
mm,
warmest part of the day. So I expect that their lungs will sound fine by then,
yes.
because that's not when the problem is. And so we acknowledge that as an issue. I think um, one of the really helpful things can be saying to your GP, if they're saying, "Oh, it's not asthma," "Oh, can you just explain?
Mm,
I was worried. I know that the asthma symptoms are worse usually through the night and
mm,
worse at these times of day, and his are worse through the night. Can you just explain to me why you think that's not the case?"
mm,
And keep asking until you have an
mm,
explanation that you're satisfied with. And the
mm,
other way might be saying something like, "Well, I was wondering if this was could
mm,
be a worsening of asthma. Do you mind
mm,
if we try one of the step-up inhalers just to see if that's
mm,
going to benefit?"
mm,
And I think it just engages in a conversation about what you think is happening
yes.
and what the possible options are, um, and opens up a conversation about that.
Mm. You make a really good point there, in the sense of in managing asthma, it's really important for the person with asthma or the parent of a child with asthma to actually do, not hard research, but do some reading up to actually get their head around what asthma is as well.
Mm,
And then even ring Asthma Australia on their 1-800 asthma number and have a conversation with an asthma educator. Because I guess it's about, as you were saying earlier on, if we can put all the pieces of the puzzle together, that then gives us the picture. Whereas a symptom in isolation can be extremely difficult for a GP to make a diagnosis. But if they've done their reading and they've done their research, there's no harm in them saying to their GP, look, can we increase their medications,
mhm.
or is there another test that we could do? I've heard of this spirometry.
Yeah,
Would that work? Or
absolutely.
yeah.
And the asthma action plan can be a real friend in that as well. Because if you've got
Mm,
an asthma action plan, it'll probably say when symptoms are worsening, for
mm,
example, overnight. And so it's quite possible to say, but this is actually what's happening on the asthma action plan. And it says at this stage,
mm,
this is the action I take. I'm sort of
mm,
seeking GP, perhaps add in a different inhaler.
mm,
Isn't that what we should do? And
mm,
so, because it's a sort of a shared plan about what
mm,
happens at each symptom stage of asthma, so again, that can be a really useful
mm,
um, use for
mm.
discussion with health professionals.
And can any doctor, any GP do an asthma action plan for somebody with asthma?
Yes, absolutely. And I think it's better if you have a GP that you know and trust, and that
Yeah.
they know the way that your asthma is behaving.
Mm,
That's not always the case, because many people, for many reasons, including being well, don't often get to see the
mm,
GP. So
mm,
any GP can do one,
mm,
and ideally find a GP that you know and trust, and
mm,
then the asthma action plans will actually be even better than they would if they don't know you.
mm. Awesome. Another question that's come through, Tim, on our World Asthma Day Facebook page is actually about yawning, and this person is actually saying, "Is yawning a symptom of asthma?"
This is really interesting. So when you look through the textbooks, it's usually not described as a symptom, but there's it's certainly reported by patients that it is, and the mechanism of yawning is actually to draw more oxygen into the body. So it's quite plausible that for some people, when they are having an asthma attack or their asthma is worsening, the body responds by going, let's draw more oxygen in, and one of the mechanisms for doing that is actually yawning. And so it's not well reported. There's a little bit of reports in it associated with something that people have started to call dysfunctional breathing, which I'm not sure I found a helpful term, but there are some I suspect it's a symptom of asthma that's not common, but that many people will have, that's not well reported in the medical literature. And there's some other symptoms like that wouldn't be common, but I've come across too, like an itchy chin.
Okay.
Can't explain that at all, but sort of you hear about some people reporting that sort of thing.
Well, I've never heard of the itchy chin.
Yeah,
I've
it's weird,
heard
isn't it?
about yeah, very weird. I kind of go, how does that connect to the lungs and the narrowing of the airways and the mucus production? How do you get an itchy chin? But it
Yeah.
comes back to your point in the sense that it's really important for somebody with asthma, one, to know what their symptoms are and how their asthma impacts them, and also to watch their children if they have kids.
Absolutely.
And look at how their children display their symptoms, and not to dismiss something and going, oh, well, that can't possibly be asthma because it's not a wheeze or it's not a cough. So if a child is constantly yawning, as you said, it could be an indication that perhaps something isn't quite right with their asthma. Tim, we're coming to the end of our interview, but just before I wrap it up, just to give you the opportunity, is there anything else on World Asthma Day? Is there anything else that you think would be important for people to take note of or to hear, or is there another key message you think is worthwhile getting out there?
Yeah, I think it's important to, we were talking about asthma action plans earlier, and I think though it can be really important to know your symptoms and have an asthma action plan for you or for your child that sets out what to do at each stage of the symptoms, because then, and that can be used with relatives who might be looking after the child, that can be used in school and daycare, it can be used in workplaces, so that if things do get worse, there's not a sense of panic. Oh, what do we do? It's a plan that's formulated in advance. And I think and one of the important things we know about as asthma gets worse is actually being able to keep calm during that, because it's a terribly anxious time when you're with someone who feels they can't breathe. And so having that plan, knowing what to do should those things happen, having it reviewed regularly with a GP and asking questions that are any uncertainty, and knowing your own symptoms, that can be really useful in setting out what's going to happen should asthma start getting worse, and what's going to happen to keep it settled and not limiting.
No, really good point. I was reading something just recently that said something along the lines of asthma ownership in children is reasonably high. I can't remember the statistic now, but in adults was incredibly low. So it's almost like as parents, we ensure our kids have an asthma action plan. But for people with asthma, it's almost like, oh, I don't need an asthma action plan. I'll just take my puffers. Tim, great to chat with you on World Asthma Day. I think we've had a great discussion where we've really talked about what asthma is, what are the three things that it's caused, so the narrowing of the airways, the excessive mucus production. We've talked a bit about the symptoms of asthma, that symptoms can vary from person to person, that some people can cough or difficulty speaking, wheezing, shortness of breath. We've also talked about the importance of actually looking at your own asthma pattern and your children's asthma pattern to see when symptoms worsen, because as you said, asthma is caused by triggers. And if we can narrow down some of those triggers, then we can find an easier way or a more effective way of managing asthma. So avoiding those things like smoke or cats or pollen, etc. And then what we wanted to do today was really debunk that myth of if it doesn't wheeze, it isn't asthma. And I think we've done that well. So what we've shown is that you can have asthma with a wheeze and you can have asthma without a wheeze, and that asthma can present itself in many different ways, but not to rely on if you're not wheezing, it's not asthma, and not to narrow in just on one symptom of an asthma flare-up or an asthma attack, but to actually look at the whole picture. And then finally, the last thing I'd say, I really liked your point about coming to the GP and bringing all that information with you as a parent or a person with asthma. Give as much of a clinical picture about how it impacts your lifestyle when you get your symptoms, and then even offering suggestions. Well, could I have a spirometry test? Can I increase my medications? And saying to the GP, I don't have an asthma action plan. Will you write one for me? Tim, thank you so much for your time today. It's very much appreciated. And thank you so much for shedding some light on a complex topic of asthma. And I look forward to us doing another one. Thanks, Tim.
Been my pleasure. Thank you very much.